Welcome for you in this course. Type 1 Diabetes and Pharmacology, Precaution Adoption Process. Congratulations for having this chance, and all I can say that I'm really so proud to be with you. I am Maram Abdel Nasser Tashdaya, a Palestinian pharmacist and American Studies instructor who is teaching on Udemy. Diabetes mellitus is actually one of the most popular chronic ailments in nearly all countries and persists to grow in significance and numbers as variable lifestyles drive to decreased physical activity and elevated obesity. Diabetes is actually of two kinds. Kind 1 is an autoimmune trouble of childhood depicted by ketoacidosis, acute onset, insulin dependency, and thymus. Kind 2 is a metabolic trouble of middle life generally connected with obesity, non-insulin dependent, and slow in happening. The aim of this course: diabetes may be determined based on A1C standard or plasma glucose standard, either the fasting plasma glucose or the 2-hour post-load glucose measure after performing a 75 gram of oral glucose tolerance test. However, the precaution adoption process model, a phase-founded model that determines phases along the path to preventative health action, directed the study hypothesis and goals. Course questions: adoption of a modern precaution or cease of a risky behavior demands the deliberate phases unlikely to happen outside of conscious recognition. The BAPM utilized to these kinds of action. It is thus essential to attain an obvious general review of the path the ailment has altered through time. Did childhood diabetes actually become more popular in the 21st century? If that is the case, where and when did the race start? Is there a total manner to the race? What conclusions can we sketch regarding its reasons? Significance of the course: physicians embrace a more relaxed situation, and a glimpse through a medicinal textbook soon detects that we require a logical or indeed uniform foundation for classifying ailment or for subclassifying an offered trouble. This course depicts the BAPM, a stage method that demands to health defensive behaviors. The model confirms that advancement toward behavior alteration is best demonstrated in expressions of a chain of qualitatively diverse stages. Method: the BAPM and other phase methods or models propose that commune at various points in the procedure of precaution adoption conduct in qualitatively various tracks, and that the kinds of information and interventions required to move commune closer to action differs from phase to phase. Owing to the truth that the BAPM is not content of a shortened list of factors, it does not present a plain procedure for designing interventions. To some extent, it is a scope that can be utilized to identify obstacles that prohibit move from one phase to the next. Results and conclusion. However, it is logical to recognize an A1C extent of 5.7 to 7.4% as determining individuals with prediabetes case. Commune in maintenance and action have often altered their behavior, and as well in these phases self-efficacy, confidence in skills is probable based on expertise rather than realization. In fact, it would be unattainable to discover the function of a factor that might become crucial to commune leaving or reaching a particular phase, and is pivotal to the precaution procedure but not pertinent to the transitions. Phase methods propose that we will be preferable able to recognize essential obstacles if we compare commune who are in relative phases. Who this course is for: people from all the world who have an interest in the following approaches: precaution adoption process model, pathology, laboratory sciences, nutrition, health behavior, health education, health and risk management, health psychology, clinical pharmacology, diabetes care, health promotion, nutrition, endocrinology and metabolism, medical sciences, clinical pharmacokinetics, autoimmunity, clinical chemistry, clinical therapy, and biochemistry, and this course contains 57 resources. Many thanks for your attention, and I'd like to invite you to enroll in this course or to try the free preview if you want to explore further.